I'm Ashley Simmons. I work with the Florida Hospital Performance Improvement Department for the system, covering the 7 campuses located in our Orlando region. There are 12 of us on the team. I am one of the Lean Six Sigma Black Belt certified team members, and I'm currently assigned to or working with Celebration Health on their innovation project. So Celebration Health went with RTLS in design of the new tower and specifically the innovation unit to really begin to integrate how we communicate and track not only processes within the workflow of ourselves as a care team, but our patients, to monitor what that flow looks like from the patient standpoint, from the time they enter our door to the time that they hopefully leave in a much better condition than when they came. AeroScout was selected as our RTLS vendor because we truly saw them as a partner that we could use to really build the foundation for the other advancements in technology that we hope to achieve throughout our new tower and innovation unit. They really have become the foundation, the glue that we'll be utilizing in terms of pulling in all the other partner technologies that we have access to really build the type of infrastructure that we want on this unit to truly advance and change the way that healthcare is delivered at Celebration Health. So RTLS on the innovation unit and using the AeroScout technology, we have been able to see improvements in terms of the processes and workflow that we analyze on a daily basis with how the staff function and do their work. So this allows for us to determine how can we better impact your workflow. Are you spending multiple hours of your day searching for equipment? Are you traveling multiple steps on a unit because of your assignments in terms of one patient is assigned to a room in front of the unit and your other patient is assigned to a room in the back of the unit? How are we assigning your workflow? Those are the types of things we were looking for. And then in addition, we also wanted to be able to determine if you're spending 10% of your time in a patient room, how does that correlate to the patient's satisfaction and their outcomes versus maybe a nurse that spent 50% of her time in the nurse's room? Are there truly correlations there? And that's something that in the industry right now we just really don't have in a real-time environment. And so that's what it's been able to provide for us and what we hope to see correlations with in the future. So some of the solutions we've installed in the innovation unit are we can have the presence and accuracy of staff entering and leaving the patient room, the nurses station areas, etc. throughout the unit, as well as the tracking of pumps throughout the facility so that we can monitor where those resources are that the nursing staff so critically need throughout their care delivery to the patient. As well as the temperature and humidity monitoring within the patient rooms, so that when the patient tells us there is a change in temperature that's maybe too cold, too warm for them, we can identify what the accurate temperature is in that room and adjust it accordingly. So the future of RTLS in the innovation unit is to expand to hand hygiene monitoring. It's an area of healthcare that is very tricky to monitor accurately, as well as capacity management and being able to ideally start to predict our volume fluctuations. For example, when the Disney World park closes at a certain hour of night, we see an increase in volume in the emergency department. So how can we begin to utilize that technology to predict that volume influx, be prepared with where our pumps are, where our resources are in terms of staff, etc., to be prepared for those types of volume fluctuations. And then seasonally, as we have the snowbirds come in the winter, to be able to start to predict what that capacity management looks like and truly provide the best in care to our patients at all times. So one of the things we've been most excited about throughout this journey of innovation at Celebration Health is not only our partnerships with many of our vendors and strategic partners, but watching the relationship building between our partners, such as AeroScout and Get Well Network and AeroScout and Cerner, and watching those relationships develop into solutions that we had not anticipated in terms of improving healthcare. So that's been really exciting for us to see and something that we're so very proud of to have been an instigator in those conversations and really allow that dialogue to begin. So it's been something that we're extremely excited about and look forward to the future.